So if a person wearing a denture goes to your practice for dental implants, or a person that you cannot save all their teeth and they need a full mouth of extractions, what are their options in your practice for dental implants?
We see lots of patients that have dentures and frankly they're not happy with them. One of the best options to get those dentures more comfortable would be to place implants, and then you can actually fixate that denture. Probably the first step in that would be placing 2 implants. Say you've got a lower denture, and the lower dentures are typically the worst because every time you eat or move your tongue around, you kick the thing out on the ground. With 2 implants, you're able to actually fixate that denture. It clips in, and it's still got some wobble to it, but you don't have to worry about flicking it on the ground when you're talking to your friend. No more adhesive. You don't have to use any more fix-it-in, any more adhesive there. So it clips in, and a lot of patients are very happy with that. It's a great option. It's definitely it's reasonable as far as the cost is concerned, and as far as the comfort, it's a huge step up over a traditional denture. And the next step up from there would probably be place maybe 4 implants. You can do the top, you can do the bottom, place 4 implants. That, it still would clip in and out. It wouldn't have any wobble to it, so if that's something you're concerned about.
And they can eat whatever they want with that.
They can eat whatever you want. You still may have a little bit of palatal coverage there, so if you want something that you don't ever take in and out, which is obviously the ideal here, we can place maybe 5, 6 implants here. So we're able to give them a full arch of teeth. And sometimes we're able to do it in a day or maybe a couple days, where they come in with no teeth that are savable. We can take out all their teeth, place all these implants, and essentially that day they can walk out with teeth. They can walk out with teeth most of the time.
So no more dentures.
No more dentures. So you can come in with either teeth that you know are not great, they all need to come out, or if you've got a denture right now, and you can walk out with something that instead of having a denture, instead of having those plastic teeth that you got to pop out every night, you got something that feels and just feels like your natural teeth. And you're able to eat apples with it. You're able to eat steak with it. It's something that's great for you. It's a huge service that we can do for these patients.
So you do a lot of implants in your practice?
Oh yeah, lots of implants all the time.
How do people hear about you?
A lot of patients, they come from general dentists. The general dentists, they say, you know what, you've got a problem, go see Dr. McCauley, and they'll come from that. But we've got a lot of patients nowadays coming from the internet or from word of mouth, because if you check our internet, if you look at our Google reviews, we've got hundreds of 5-star Google reviews. It's great, and that's sort of the new word of mouth these days. You see people, I'd say most of our patients look us up on Google before they even come in, and you know what, we've got great reviews, and it's important to a lot of people to know that your dentist or your periodontist has lots of happy patients.
Why go to a periodontist to get your dental implants?
It's the training. It really comes down to the training. I did 3 extra years of training compared to a general dentist, where a general dentist, a lot of them, they just go to weekend courses to learn how to do implants. And, you know, you learn the basics there, but a lot of these cases, there's a lot that goes into these implant cases. And you want someone that's got the experience and the training. Because you're dealing with the gums, right? And the periodontist is, I mean, you're the gum specialist. I'm the gum specialist. So we're able to get these implants looking the best, because we're able to manage those gums so effectively. So
how old can you be to get dental implants?
As long as you've stopped growing, then you can get dental implants. And so that's the lower bound. And the upper bound, I've placed dental implants in people that are 80, 90 years old.
Why would a 90-year-old want to do this?
Because they still want to eat and chew. I mean, you're 90 years old. You want to enjoy your food these days. Come on.
And so it doesn't matter how old you are.
No, it doesn't matter how old you are. You can do this in all patients.
Now, isn't it true, though, if you've been wearing a denture like 20 years, you don't have enough bone to do this?
That is not the case in a lot of these. Sure, you have less bone, but sometimes we may end up having to do bone grafts or things like that. But I'd say a majority of cases, we're able to do these fixed replacement of teeth, basically give you teeth, and without much bone grafting, without any additional procedures.
And you'll work with their general dentist, right? Like a team.
Oh yeah. No, we work with hundreds and hundreds of general dentists all across the city, county, and even the country. So we're able to work with all general dentists, and we're able to do the implants and allow them to replace the teeth for them.